Hello and welcome to National Focus. I'm Kerdisha St. Louis. Coming up, government details partnerships for improved healthcare. The Discover Dominica Authority partners to host fringe events for jazz and Creole. And April 12th is International Nurses Day. Details of our headline stories and more after this.
Dominica is blessed with an abundance of water, but getting it to your home is an expensive venture. You have a responsibility to conserve water, to use it wisely. Remember the old adage, you never miss the water till the well runs dry. Think water, think life.
Thanks for staying with us. The Ministry of Health has been hard at work under the leadership of the new Health Minister, Dr. Kenneth Daru, to forge links that will bring a better health care to Dominicans. At a press conference last week, Permanent Secretary in the Ministry of Health, Helen Roye, revealed that memorandums of understanding have been signed with the Dominica's French neighbors. Often, patients in need of urgent medical services which are not available in Dominica are airlifted to Guadeloupe or Martinique for care. Often, that care is affected by smaller challenges. It is those challenges that government is seeking to eliminate by signing these agreements with these countries. Roye discussed the new arrangement forged with Guadeloupe.
Some of the things we intend to see is assistance like exchange visits, where we would have the specialists visit our country and see our patients, and at the same time our staff will have the opportunity to go for training in this area.
The Permanent Secretary describes the extent of this agreement with Martinique.
Persons were being referred for emergency care in Martinique and Guadeloupe, and sometimes we had issues if they do not receive the payment on time before they would not come in. So the government had invested in ensuring that our facility manager visit Martinique. So she has been to Martinique twice to speak on our behalf, to meet with the agencies and to kind of make the relationship a little swifter for persons who are needing care. And we have seen the improvement. They have actually providing us reduced rates and training for our staff. On Sunday, 2 of our nurses from the ICU unit left Dominica for Martinique to get trained in ICU because of that MOU.
This, Roye says, means immediate care for Dominicans in Martinique.
If we have a case to be sent in, the facilitator can know our facility manager. She can call them directly. She has all the addresses. She knows exactly who to call. And the delays that we used to experience before, it is very much limited.
Currently under review are 2 more MOUs, this time with the governments of Venezuela and China. The partnership with Venezuela is geared at eye care.
They will be working together with our eye specialist in Dominica, and the persons will be reviewed and assessed by our Dominican counterparts, and then they will work closely together with us in providing surgery for cataracts, for glaucoma. We intend to embrace that idea because we realize a lot of the conditions that we have in Dominica, we do not have the capacity to deal with it almost immediately.
In 2013, the government announced that it would spare no expense to introduce eye screening at primary and secondary schools on the island. This announcement came as a result of a growing number of requests from parents seeking government's assistance to meet their children's eye care needs. Now the Ministry of Health is saying that the program has so far been piloted at 2 primary schools and the results are very revealing.
I am pleased to inform that we have actually started and have engaged personnel on the doing the groundwork before the team from Cuba comes to do the program. So to date, we have had a coordinator appointed and 3 staff nurses working alongside with our district health team. They have actually piloted and together with our own consultant, Dr. Shillingford Ricketts. They have actually piloted the program in 2 primary schools, and based on the results, I was informed through the report that actually they got cases where children really need glasses. So
Roye says government realizes that a real need exists for these programs, and so steps have been taken to introduce the program in more schools. Parents and teachers are well informed and consent forms have been signed. The requisite equipment has been purchased, cleared, and is ready for use, and medical staff is already being trained.
We intend to launch the program, starting off with the media campaign and informing persons exactly what is going to be done from when. And I think very soon we'll be informing you when the Cuban team will be here to start this very important program. But I was very pleased to know that based on the pilot project, that they have already seen persons that were referred to the eye specialist for glasses. So you can imagine if they just did a small fraction and they could get that amount of children needed the care, you can well imagine if we have to do the program in the whole country. So this is supported fully by the government from the Ministry of Finance, support for both the engagement and the provision of care. So, and we have been working together with our local medical staff to ensure a swift execution of the program.
In more news, the Discover Dominica Authority, DDA, is partnering with the stakeholders to host fringe events leading up to the 6th annual Jazz and Creole Festival. Marketing Director at the DDA, Ezra Winston, says that the organization is appreciative of all the partners involved in making the Jazz and Creole Festival a success.
And we want to thank those stakeholders, those of our sponsors. We want to thank all those who have come on board with us and decided to host fringe events, because we know we alone cannot do it. We cannot do it alone, so we need the support and we need the help of all those in the private sector who can come along and play their part to be part of this festival, this Jazz and Creole Festival this year. We want to thank the hoteliers, we want to thank the restaurateurs, and we want to thank also the patrons that have already purchased their tickets. So we want to tell you to continue to support the event.
Fringe activities for Jazz and Creole include a sunset cocktail event on the 17th at Deschamps in Portsmouth, a World Sound and Power Jazz edition on the 21st at the Anchorage Hotel, and Riverside Jazz and Creole on the 23rd at the Riverstone Bar and Grill, among others. All leading up to Jazz and Creole slated for Sunday, May 24th at the Cabritz National Park. Winston revealed that there will be a special price on Jazz and Creole tickets sold at the fringe events of $60. The marketing director urged other private sector businesses to come on board in hosting fringe events.
We here at Discover Dominica Authority and DFC, we do support, we wholly and solely endorse this, the fringe events. They all form part of Jazz and Creole. So we want to call on the rest of the hoteliers in Dominica, other stakeholders, to play their part and to sponsor, to be part of it, and to also host events for the next year and the years to come.
You're watching National Focus. Still to come, youth cautioned about hypertension. Stay with us.
Did you know the Caribbean Court of Justice is 2 courts in 1? The CCJ has 2 functions: an original jurisdiction, which deals with your right to move between CARICOM countries freely and your right to move your money and your business. This is the basis of the CARICOM Single Market and Economy, CSME, and the revised Treaty of Chaguaramas, and an appellate jurisdiction to hear appeals from courts of those countries which decide to use it as their final court of appeal and no longer go to the Privy Council. All CARICOM member states who have signed the agreement establishing the CCJ are members of the CCJ.
Welcome back. High blood pressure or hypertension is a common condition in which the force of the blood against your artery walls is high enough that it may eventually cause health problems. At an annual health fair held last month by the Dominica State College, Nurse Sylvia Julian called on Dominica's youth to be observant, as high blood pressure, a disease commonly thought of as an adult problem, is now being seen in teenagers and even younger children.
High blood pressure is one of the lifestyle diseases. That means our lifestyle, the things that we do contributes to high blood pressure. What we have seen in the health sector is that previously, the older people would come down with high blood pressure, but now we have 14 and 16-year-olds who are coming down with high blood pressure.
High blood pressure can remain undetected for years without any symptoms, but even without symptoms, damage to blood vessels and the heart continues and can be detected.
High blood pressure is usually known as silent killer because of the way that it works, because of what happens. You may have no symptoms, but it damages your body. So women are usually at greater risk, and also familial history. So if your mother or your father or your grandfather had high blood pressure, then you are at greater risk of developing the disease.
Nurse Julian notes that uncontrolled high blood pressure increases your risk of serious health problems.
When the blood pressure remains high, it affects systems, it affects organs in our body. So we have vital organs like our blood vessels, they get damaged, and we know that the blood vessels have to carry the blood to all areas of the body and to the vital organs. When this function is impaired, then you have damage, especially to your kidney. So some people who have high blood pressure, you find that they develop renal disease, kidney failure, right? So this is also a complication. You have cardiovascular diseases, because high blood pressure is essentially a disease of the heart and the cardiovascular system. So you have these people developing cardiac problems, and stroke is one of them that they can experience, and also death.
The healthcare provider told the young people that the risk of high blood pressure can be reduced through proper diets and lifestyle changes.
Some of the lifestyle changes, as I said, is our diet. So we decrease the amount of salt and fat that we take in our diet. We increase our physical activity, and we live a life that is less stressful. The stress will always be there, but we try to manage our stress, and this will help us in managing or saving ourselves the risk of developing high blood pressure. So it's in our court, each and every one of us. Let us do what we are supposed to do, take charge of our lifestyle, avoid smoking, alcohol use. We have to limit our intake of alcohol, or better yet, avoid alcohol use, get active, and watch what we eat. These are the things that will help us not to develop high blood pressure.
And finally, this news time. Tomorrow, the 12th of May, the world will celebrate International Nurses Day, the anniversary of Florence Nightingale's birth. In Dominica, the Ministry of Health is partnering with the National Nursing Association to hold a week of activities in recognition of nurses across the island. GIS News sat down with Acting Principal Nursing Officer Leticia Lestrade-Wyke, who said that activities begin on Monday, the 11th of May.
The day will be celebrated tomorrow, May 12th, but today we have a church service, and this will be from 3 p.m. at the Christian Union Conference Church at Goodwill, where all our nurses, retired, those in active practice, will be attending, and we felt that this was one of the best ways, to begin the week of activities. What can we do without praise, and worship? And as we know, God gives us the strength to do everything. So we are going to invoke His presence in our activities this starting today.
Activities for the day's commemoration include a public speaking competition.
Tomorrow we have the public speaking competition, and we have nurses from the districts, nursing supervisors from the districts and the hospital. So for the district we have what we call 2 regions, Region 1 and Region 2.
So Region 1, which is from Roseau all the way down to St. Joseph, we will have 2 participants. From Portsmouth to Lapland, that's the next region, we're going to have 2 participants. And from Princess Margaret Hospital, we're going to have 2 participants.
WIC notes that the theme relates to activities involved as nurse managers will be advising the younger nurses on how to efficiently manage their resources.
Now, the theme for this year is Nurses, a Force for Change, Care Effective, Cost Effective, Improving Health and Well-being. Hence the reason why we felt that the nurse managers are the ones who are supposed to give guidance, to the junior staff as it relates to budgeting and cost effectiveness in use of resources and so on. So we felt that the managers now should do the presentations as to how they can assist in giving good care, but at the same time doing it in a cost-effective manner. So we have this on tomorrow at the new conference room of the Princess Margaret Hospital. And then persons will be awarded first place for the prepared speech. We have 2 segments. Second place, prepared speech. We also have the impromptu speech, where they will deep a question and they will speak on the question, on the topic. So they will always also be recognized for that.
We here at the Government Information Service wish to thank the nation's nurses for their dedication and service. Tips to maintain a healthy weight coming up next.
Get in and fasten your seatbelt, okay?
Mom, why do I have to wear seatbelts? I do not want to.
James, when I ask you to fasten your seatbelt, please do as I say. It's for your own safety and protection, okay?
Yeah.
Protect yourself, protect the child. Always fasten your seatbelt. Crashes can happen at any time. It is better to be safe than sorry. Remember, seatbelts save lives. A message brought to you by the Violence and Injury Surveillance System Committee in collaboration with the Pan American Health Organization.
Energy balance is important for maintaining a healthy weight. The amount of energy or calories you get from food and drinks, calories in, is balanced with the energy your body uses for things like breathing, digesting, and being physically active, calories out. To maintain a healthy weight, your energy in and out don't have to balance exactly every day. It's the balance over time that helps you maintain a healthy weight. You can maintain a healthy weight if you follow a healthy diet, are physically active, and limit the time you spend being physically inactive. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News Production team, I'm Kerdisha St. Louis. Thanks for watching and join us again next time on National Focus.
Hello? Listen, you have to call me back because I'm going to cross the street. Okay, bye.
Be smart. Don't use cell phones while crossing the street. Be safe. Use the pedestrian crossing. A message brought to you by the Violence and Injury Surveillance System Committee in collaboration with the Pan American Health Organization.